Good afternoon on this Sunday, folks. Welcome to the webinar. It is September 6, 2015. Today I'm going to talk about attachment theory. And frankly, I talk about attachment theory all the time. I just don't call it that. I don't name it. But I'm very influenced and impacted by attachment theory. I think it has a lot of relevance to communication skills, especially in the listening category. It has a lot of relevance in terms of our thoughts about codependency. It definitely has a lot of relevance when I talk about our own families of origin, our own upbringing, and how that impacts our relationship with our children and our relationship with our children's problems. So I'll get into some technical stuff today, and then I'll just try to unpack it a little bit by talking about it with more casual language as we go along. So let's talk about the basics of attachment theory. Attachment theory describes interpersonal relationships between individuals. That's simple enough. It it helps us to understand how people respond to hurt, separations, and perceived threats. John Bowlby, one of the pioneers of attachment theory, studied primates to understand how infants attach to their parents and described this instinct in evolutionary context because such instincts ensure the survival of the child. Now, let me take a moment and talk about that. Part of what people talk about when they talk about attachment theory is when a child doesn't feel heard or seen because of something they might be demonstrating, some behavior, some problem, some limitation of theirs, the instinct would kick in where I need to get rid of that part of me in order to really maintain my survival, to be able to survive. Because if I have that problem, if I have that issue, if I have that limitation, and my parent or caregiver doesn't have the bandwidth, I like that word, the bandwidth, to be able to contain it or tolerate it, then they might abandon me. And that's the instinct in us, is to get rid of the authentic self, to move toward the false self in order to ensure our survival. So that's what Bowlby was talking about, and he made that connection between studying primates and infants and the development of authenticity or the real self and that connection. Attachment theory seeks to study the parent-child attachment as a precursor in adult romantic relationships and subsequent adult-child relationships. And so this is what I was talking about, right? This is what the patterns. It's not the things that we say, not simply the things that we say, not the stuff that we talk about, not the rules that are taped to the refrigerator in the kitchen that dictate the, but it's a lot of invisible, unconscious, covert interactions that define healthy attachment or unhealthy attachment. And of course, we know that the ideal circumstance is for the child to have at least one person who provides this consistent connection. And I think that that can be helpful for a lot of you who have ex-spouses, ex-partners, co-parents who don't do this very well, right? Don't provide this secure connection. And this last point can be, and it's demonstrated in the research, and I'll get to it today. It shows us, it reminds us that as long as the child has at least one person who sees them, who gets them, they can develop some significant resilience, some significant ability to be their authentic selves. So that's some foundational stuff. Let's talk about different styles of attachment in the literature. There's secure attachment. This means that the child can explore the world freely, using a caregiver as a safe base from which to engage the world and others. And they're engaged with the caregiver when present, right? That's in our infant studies. And they found these out. They developed these. Mary Ainsworth developed these when she brought in this experiment called the stranger situation, where a parent and a child were in a room, and somebody that they didn't know would come in, and they would observe the different styles and the way the child would interact with this new person, interact with his or her surroundings, interact with the caregiver. So that's where this comes from. The anxious, insecure, or avoidant attachment style is to avoid or ignore or demonstrate ambivalence toward the caregiver. They do not explore no matter who was present. The theory suggests that this is a mask for distress, right? Overwhelming distress. And later on, we can look at the studies through heart rate monitors and see that they're under distress, but their outward presentation seems rather aloof and ambivalent. Okay? And then the anxious and ambivalent attachment. It's visible distress, clinginess during time of separation and return, difficult to console, showed resentment or passivity with regard to the caregiver's return. So these are three basic styles that Mary Ainsworth talked about. And what's interesting about this is we can see those styles into adulthood and the way that people respond to each other, to new situations, to transitions. So that's some background. Let's talk about John Bowlby's ideas and contributions. He was very influential. He studied maladapted or delinquent children. He was very influenced by those studies and also the primate studies that I discussed earlier. He concluded that the infant and the young adult, excuse me, and the young child should experience a warm, intimate, and continuous relationship with his mother or permanent mother substitute, in which both find satisfaction and enjoyment. Again, very simple, straightforward stuff. Bowlby had the view that children were responding to real life events and not unconscious fantasies. And he actually was rejected by the psychoanalysts of his time because they believed it was about fantasy, that it was about imagination. And Bowlby was able to show and demonstrate in his studies the idea that these were real life stressors, that the experience that children were having with their outside world as they grew up came from different qualities of attachment that they experienced in their young childhood. And he wasn't very popular with the psychoanalysts of his time because of that. Sometimes I get questions about placement, and I thought this idea related to it. Bowlby stated that boarding schools could be useful for children 8 years of old and older. If the child is maladjusted, it may be useful for him to be away for part of the year from the tensions which produce his difficulties. The boarding school has the advantage of preserving the child's all-important home ties, even if slightly attenuated from them. Moreover, by relieving the parents of the children for part of the year, it will be possible for some of them to develop more favorable attitudes toward their children during the remainder of the time. Now, this is powerful stuff. People will often ask me about my child might have some attachment issues, maybe even is diagnosed with reactive attachment disorder, is very anxious to be away from home. And sending them to wilderness, sending them to a therapeutic program, isn't that going to re-injure or recreate the trauma that created this? And what Bowlby is suggesting, what I've found over the years experientially, is that sometimes that separation allows people to be closer. How many of you can say or have said that I was closer to my child or I'm closer to my child when they're away than I ever was at home? So part of the pulling apart physically of the family allows each side of the equation to get healthier, to get more full, to be less upregulated, that is less anxious, and to be able to appreciate each other more, be able to listen to each other more, not react to each other more, and ultimately help them develop a pattern of closeness. And that's what Bowlby was suggested. So even people who do attachment theory understand that sometimes as parents, we need to feed ourselves. We need to feed ourselves, to take care of ourselves in order to improve our bandwidth, right? Our capacity. My favorite Buddhist teacher says that if we can't approach the other, and in this case it would be the child, with a dear one attitude, a mindfulness of compassion and a love and a patience, no matter what's going on with them. When we can't do that, then we should go away, tell the person, I need to go away and take care of myself so I can come back and be present with you. And that's essentially what Bowlby's talking about. So the differentiate, it's frightening for us, right? And I think for those of us who have some anxious attachment styles, it's actually traumatic for us because of our own concept, our own construct of the parent-child relationship to be separated from our children. But attachment theorists can agree that sometimes the proximity, the close proximity, is not an advantage in these situations. Research suggests that children who have had a positive connection in life have a source of resilience for dealing with life's challenges. That is why it's so critical that we learn to listen and see our children. And that we don't look at them with judgment, with they're sick, with they need to be fixed, right? If we look at our children simply as they're sick and they need to be fixed, we can't really see them. And shifting just a little bit to say, I think they're struggling and they need some healing. There's a wound there that is unaddressed. This behavior, this symptom, this issue is evidence of that wound. That's a very different kind of response than they're sick and need to be fixed. And even as a therapist, the moment that I think about a client in that way, they're sick and they need to be fixed, is the moment I lose connection to them. The moment I lose my capacity to be able to see what it's like for them. My daughter said this to me. My 7-year-old daughter said this to me yesterday. We were driving around. She said, "Dad, I have something for you for your psychology." And I said, "What is that, Isabella?" She's 7 years old. This happened word for word, as close as I can get it, word for word. She said, "When you're talking to parents, maybe you could help them to remember how hard it was to be a child. I think that would be very, very helpful for them in their psychology." And part of what she was saying to me is, I don't think that you remember how hard it was. Sometimes your frustration or impatience or anger or disappointment, whatever it is that she's feeling from me, sometimes, Dad, I think that you forgot how hard it was for me and you've lost connection with me. But how wise, how amazing from a 7-year-old. Siegel and Hartzell also say research in the field of child development has demonstrated that a child's security of attachment to parents is very strongly connected to the parents' understanding of their own early life experiences. So that's what I go back to. That's what the journey of the heroic parent talks about. To the extent we can see our own lives, our own history, our own selves clearly, we have the capacity to attach to another. That is why the pulling up the part and self-exploration is a necessary precursor to healthy attachment. Most of us want to do this. Like, how do I do this, Brad? How do I get like this with my child and then with me? And the response, the solution is counterintuitive, because the solution is to pull it apart, to look inside yourself, to develop a foundation, a capacity, a bandwidth, an ability to be able to contain, to see, to hear the child. But we want to do it outwardly. We want to do it in the other. I'll get to your questions at the end. Speaking of reactive attachment disorder, reactive attachment disorder is a rare but serious condition in which an infant or young child doesn't establish healthy attachments with parents or caregivers. Reactive attachment disorder may develop if the child's basic needs for comfort, affection, and nurturing aren't met with loving, caring, stable attachments with others. They're not established. So it's a severe disorder. And it's often associated with adoption, or I should say the giving up of adoption. But remember, part of that is because the child still has this experience of the parent that was the one to have given this to them, of abandoning them, even if you come in quickly with all the love that you can offer. And then sometimes, of course, there's a fit issue, right? There's a difference of fit between a parent's personality. That can happen in non-adopted families, and that can present its own challenges. Then, of course, the child comes with, in many cases, with adopted children, pretty significant organic issues, which make it difficult at best for a parent to attach because of the way the child is behaving, or difficult to soothe, or has other deficits. That can prevent difficulty. And again, it's not simply, that the child is terminally, fundamentally flawed. It's just different and difficult and challenging for that parent. So, with treatment, children with reactive attachment disorder may develop more stable and healthy relationships with caregivers and others. Treatments for reactive attachment disorder include positive child and caregiver interactions, a stable, nurturing environment, psychological counseling, and parent or caregiver education. And that's part of what we do here, right? We do all of those things. We're relatively short term, but we re-educate, reorient the parent, help the parent. Part of the weekly phone calls with your Evoke therapist is to help you see the child, right? It's reframing, saying, this is what I think is going on with them. Parents say, I don't know what's going on. I don't understand. I don't get why they're doing what they're doing. So part of our job as therapists is to first find the child, and then second, provide that to you so that you can look at him a little bit different. Look at the world through their eyes. Like I've quoted many times, Alice Miller, who also wouldn't call herself necessarily an attachment theorist, an attachment therapist, describes this idea that a parent can provide this necessary kind of parenting if only he or she will not get in the way of others providing it for the child. And that's what happens sometimes. That's what happens sometimes in my life with my children who haven't gone to treatment, that there are other people that they can feel attached to, feel connected to, feel seen by. whether that be coaches, scout leaders, therapists, teachers, and so forth. When parents understand that they can let their children have and express their desires without having to fulfill them, it frees the parent to make a connection to the child's experience without having to deny their feelings. That might be one of the most profound paragraphs and quotes that I've read that I think really helps us to operationalize the difficulty that we have as parents. I'm going to read it again slowly. When parents understand that they can let their children have and express their desires without having to fulfill them, it frees the parent to make a connection to the child's experience without having to deny their feelings, right? And so much of the time, we struggle when our child expresses anything, especially their feelings, their feelings or their needs as it applies to us in our role as a parent. And so part of what we do when we do this work, when we explore our past, when we explore ourselves, which is the same thing as our past, right? When we can do that, then we have the capacity to see and hear the child. Because we don't need to marginalize it, justify it, right? We don't need to make it a problem. We can just see what it is for what it is. Of course, all parents and therapists fail at times, some more, some less. But some parents and therapists, i.e. containers, cannot maintain a balance of mind, and failing, the parent becomes a container that is either too rigid or too fragile. A rigid mother takes in and utters formal responses without a real understanding of the infant's distress. A fragile parent will, when confronted by her distressed baby, go to pieces and panic. In either case, the infant receives back its own projection with the implicit message that after all, as it feared, its state of mind is not tolerable. It suffers, in Bayon's terms, a nameless dread. That is a state of mind that is not thinkable. Somebody asked me the other day, do your parents get it through this process? Right? We were talking about the children and the work that they do, and I was talking about my parent education. Do they get it? And I said, yeah, a lot of them do. And it's, here's the line. I think the parents that get it are the ones that can say, I have work to do. It's that simple. They don't get it to the end. They don't finish their journey. They don't finish their work, but they look inward. And they have the ego strength to be able to say, there's some stuff that I'm doing that's less than ideal. Some of it's far less than ideal. And I'm not so threatened by that idea that I need to defend against it. I'm not so threatened by that idea that I equate that kind of thinking with blame. I'm not so threatened by that idea that I have to push it out of me onto the child and discuss and focus on the child's problemness, badness, sickness. But I can say that they have some of that stuff. They are struggling. There is some stuff developmentally, psychologically, mental health wise, addiction wise, that is going on with them. That's a reality. But I can focus wholeheartedly on my part of the dance without falling to pieces, without being so threatened by it that I throw up all kinds of different defenses. That's the work. That's the invitation. And it can come. And we even can look back at why is that so hard for some of us to do. The funny thing is when I was describing this to this person responded and said, well, I was a great parent. And then he laughed. And I thought, well, at least you can laugh at that. And then he went on to tell me how he was a great parent. And I said this. I said, I've never heard a really great parent tell me they were a great parent or a good parent. Most of the parents that I think are really amazing are the ones who say, I did the best that I can. I screwed up a lot of stuff. And I make a lot of mistakes. I'm a very human parent. I love my child, and my love has limitations at times. I love my child, and I'm not a great listener sometimes. I get anxious sometimes. Sometimes I get reactive. My own childhood taught me this, and I reacted. That's how a good enough parent talks, is they can talk about their humanness without shame, without fear, without dread themselves. And if we spend a lot of time talking about how great we are as parents, it's often evidence of some fear, some anxiety, and some shame. So putting it into practice, Jessica Benjamin, who wrote a great book called The Bonds of Love on attachment theory, said, recognition is that response from the other which makes meaningful the feelings, intentions, and actions of the self. This is a clever way of saying, like I quote her often when she says that the root of the self is almost always discovered through another person. That when somebody else finds me, sees me, has enough bandwidth to tolerate who I am and all of my imperfections, then I can find myself. And when I find myself, I can then heal and address my wounds, my difficulties, my symptoms, all of those things. Children learn about themselves by the way we communicate with them. Remember, that doesn't say by what we say to them, by the way we communicate with them. It's the same thing in Journey of the Heroic Parent where I say it's not so much what we say to our children, it's what we think about our children that develops in them the way that they think about themselves. So, part of the business of psychotherapy is to discover and create alternate experiences for thoughts, feelings, and attitudes and beliefs. This is undertaken in the service of freeing people to be able to re-experience themselves in a safe but different context. The virtue of talking to an empathic and accepting person who has a different base is that it quickly illuminates one's own. What was automatic and unconscious is now noticed and discussed. That's from my therapist, Jamie Gill. And let me describe what she's talking about. The moment that I walk into my therapist's office and show this part of myself, that in the case of my parents would have caused great fear or anxiety or sadness or disappointment, and my therapist just sees it and says, oh, okay, let's talk about that. I'm curious what that's about. Replacing anxiety with curiosity. Replacing sadness or dread with interest, understanding, and empathy. And when I experience that, when one experiences that, then one all of a sudden says, oh, so that's not just bad. That was not about me. That was about I bumped up against my parents' limitations right there. But it's hard to understand that merely academically until we really have a different experience. Like I've said in old webinars, that's your children's symptoms don't frighten me as much as they frighten you. Now, my children's symptoms frighten me much more than they would probably frighten you. So it's not about me being on a different level. It's just a different role, a different capacity in that role. So that's part of what therapy is to provide a different experience. Do your work and not your child's work. From Jessica Benjamin. It is too often assumed that a mother will be able to give her child faith in tackling the world even if she can no longer muster it herself. And although mothers ordinarily aspire, they always talk about mothers. It's the primary caregiver, which traditionally has been mothers in this country, but it can be whoever the primary caregiver over the first 5 years is. And although mothers ordinarily aspire to more for their children than for themselves, there are limits to this trick. A mother who is too depressed by her own isolation cannot get excited about her child learning to walk or talk. A mother who is afraid of people cannot feel relaxed about her children's association with other children. A mother who stifles her own longings, ambitions, and frustrations cannot tune in empathically to her child's joys and failures. The recognition a child seeks is something the mother is able to give only by virtue of her independent identity. The mother cannot and should not be a mirror. She must not merely reflect back what the child asserts. She must also embody something of the not me. It's a wonderfully. By the way, this is a good reminder because this is such a quote-heavy slide presentation. You can always go to our website, to the webinar, to the parent portal, to the webinars, and you can click on the PDFs of these slides. If you are a subscriber and a graduate and you don't have access to the parent portal, you can email webinar@drbradreedy.com and request the slides so that you have them, because I don't want you busily having to write notes while we're talking. But this idea says that we have to develop something, some qualities, some strength, some sense of identity to be able to provide for our children what they need in healthy development, healthy attachment, right? That is the foundation. And our limitations, and we all have them, right? We are all on the continuum of mental health, every one of us. And there's not a binary definition of this is healthy and this is unhealthy, right? We're all on this continuum somewhere. But to the extent that we can do this, to the extent that we can develop what Jessica Benjamin says, we can then begin to provide for our children what they need and what they require. So that's why it's important that we own our anxieties, we own our depression, we own our sadness. We don't put it off on them. They are not the cause of it, right? They are their own thing. And our inability to provide a sense of safety is our thing that we need to work on. So it's really important to understand that foundation that needs to be created. As a parent, Siegel and Hartz will say, as a parent, making sense of your life is important because it supports your ability to provide emotionally connecting and flexible relationships with your children. Having a coherent sense of your own life's history enables you to offer the kind of experiences that help children make sense of their own lives. There may be other times when we become aware of being filled with sensations that we cannot name or understand logically. This is our work. This is why you go to Al Anon. This is why we started family and parent intensives, so that parents could do this work, right? And in doing this work, we're providing you and your children an enduring source of strength, which is a more developed, a more conscious parent, right? That's a wonderful, wonderful advantage, resource for any age child. As a parent who has done more of their work, who has looked into their history, who understands where their knee-jerk reactions come from, where their anxiety comes from, where their anger comes from, where their sadness comes from, right? It's critical. It's important. Even if we have come to understand ourselves well, our children will still make their own journey through life. Although we may supply them with a secure foundation through our own deeper self-understanding, our role as parents serves to support our children's development, not guarantee its outcome. And they do a nice job here. By the way, all of these quotes are from the book Parenting from the Inside Out. They do a nice quote here, or a nice thought here, to talk about how the fact that there is work and things that we can provide, but we can't guarantee it. The guaranteeing of it, again, is this over-identification, this over-involvement, this not seeing the child clearly, but merely as an extension of ourselves. And that's what Siegel and Hartzell are inviting, suggesting that parents need to pull back, pull away from. Research suggests that children who have had a positive connection in life have a source of resilience for dealing with life challenges, right? That's what we're trying to provide for our children. A capacity to feel, an ability to cope, an ability to go through pain, sadness, grief, hurt, fear, frustration, without developing symptomology, without reacting in the fight or flight way that more primitive, that a child operating from a more primitive place might react from. That's part of what we're trying to provide for them in this experience and what we're trying to create for parents. Now I'm going to go to questions, but I just do want to go to these because I'm running them I'm a fan. I'm doing a heroic parenting workshop intensive out in the field this week, September 10th through 13th. I think we have 1 or 2 spots available. If you can jump on it, do it. Finding You is for any adult. Doesn't have to be around parenting, although that can be the issue. And that's also filling up. We probably have a couple of spots there too, so October 8th through 11th. If you want to attend those, because they really do speak to this, contact Stephanie at evoketherapy.com. All right. I don't have a moderator, so I'm going to have to look down and read your questions out loud. We adopted our son when he was 2 days old. He has an attachment disorder. We have 2 other adopted children who do not. Is this attachment disorder connected to a trauma we don't know about? We know of no early childhood trauma. We know that there's brain structure and organicity that would prevent or make it more difficult for a child to experience attachment. We know that. We also know that separation at birth, the moment of birth, can also be the source of attachment. The child's relationship doesn't begin with the mother at birth. It begins with the mother early in gestation. The child is actually inside the mother and feeling her vibrations. Gets attuned to her vibrations, even her heart rate, right? What escalates her. The child can be exposed to trauma through the wound. So there's all kinds of possibilities. And like I said earlier, it can also be an awareness that comes as the child conceives of the fact that the person that was supposed to be the one to take care of him or her left him or her. And so no matter how early you come in, that can still, that concept, that construct can still trigger trauma. And then lastly, of course, there are differences of fit. That can be part of it. That can be true for some adopted children, not true for others. That can be true for a child inside of a biological family where the biological parents raised them or not. Right? That can be a part of it. And we know that adopted children tend to come with some organic limitations at a higher rate than children that are raised by their biological parents. And so that's going to create difficulties. Difficulties for the parent to see, to resonate, and to attach with. So it's a whole host of things. Most importantly, for those of you who have children who have attachment disorders, it's very important, I hope, that you don't go to a place of blame or shame, that you realize that you are on a continuum with all of us of capacity to attach. And your work is on that continuum. And there's no reason to grade yourself harshly or to look for a simple answer or to say, I was good enough or to prove. It's just you have areas that you could improve on. I have areas to improve on. We all have areas to improve on. And can we look at that? So I hope that this webinar, this topic, and when you read the diagnostic manual and read stuff about attachment disorder, it can be very difficult for parents to read when their children are diagnosed with it because of what it implies. But we all have it to a greater or lesser extent. Let me just tell you this too before I go on to the next couple. I actually see most all of our clients at Evoke for now going close to 20 years as having attachment issues. Attachment informed therapy, which is part of what I practice, part of what is in my book, part is what is in all these webinars, part of what is in the supervision that I do and the teaching that I do with our therapists. It's all issues of attachment. I don't qualify myself as having reactive attachment disorder, but my work and my therapy is about attachment, right? So instead of simply labeling it in this, they have it and they don't, just look at the continuum and look at your work in it and understand how you can do better at what you can do and what your injuries and your wounds are from. The parents that go through our parenting intensives that I describe often will say, I had no idea that there was this river of energy and issues lying beneath the surface of my psyche. And that when I stepped in it through these intensives, I started to realize the impact that it was having on my life. And hopefully, I really hope that realization can come without debilitating shame. I hope it can. And by the way, if we have a healthy sense of self to a degree that we do, it doesn't need to come with a great deal of shame. Can you speak to the push-pull cycle of the child with attachment issues? I find I'm getting better able to handle the push stage without being triggered or getting angry usually, but I have a hard time not being pulled in and then feeling hurt because of the inevitable push that happens as soon as I start feeling close to my child. I'll give you an example of something that was really profound. I was dealing with a child who possibly could qualify as having a reactive attachment disorder and had some very severe symptomology. She was still in her mid-teens, so we were reluctant to necessarily come up with a diagnosis, but there were a lot of attachment issues, and the father was out of the picture for a tragic reason. He passed away. And at one point, she was doing this push-pull with the staff and the therapist every day, all day, right? And at one point, when one of the staff members asked her, what can I do to repair this? You seem to be upset with me. I thought we got past that. I thought we had a close session, and now I wake up the next morning and you're angry at me for something I thought we had processed. And so the staff member asked this young woman, what can I do? And the young girl said, I guess time. She looked down, I guess time will tell. And I jumped in and said, might I offer something else, another answer? And I turned to the young girl, I said, can I give your answer? What I might give if I was you? And she said, sure. And I said, I would say to you that if you can make my father undead, then I'll trust you. And the young girl, of course, started crying. And what we went on to talk about was, it wasn't about the therapist. It wasn't about the therapist or the staff or her peers or her mother even. It was about the trauma and the wound of being left by a father who passed away. And so this thing that she was playing out, the best answer to this question, how can you deal with it, right, is to realize it's not about you. And that is hard. That's why you need to go to places where you take care of yourself so you can come back with more strength. That's why you have your child or have had your child with us or others. So somebody else can get that who's doesn't require or need their child to do the pull as much, because we kind of need that from our child because we're missing that from our childhood, right? That's what attachment theory and development tells us, is that we need that from our child to some extent because we didn't get that from our parents as much as we could have, because they were also human and so were their parents and so on. So the push and the pull, right? The push away is, you're going to abandon me. I am going to be so intolerable at some point in this relationship that you will abandon me. So I'm going to push you away. And then when you leave, I can say, see, I knew it was going to happen. And then, of course, there's this incredibly intense desire to have that comfort, that nurturing relationship with you. And so there are times when I'm going to draw into that. But none of that is about you, mom and dad. And when you make it about you, it's really something from your childhood. And we all do. This is a more severe example that this parent is asking about. We all do this. We all do this to some extent. And it plays out in all of our relationships, even with our children who don't have reactive attachment disorder, even in our lives. I work in a neonatal intensive care unit where attachment starts off difficult due to separation. These infants can then be quite difficult as babies, further impacting attachment. These are great comments. Is there a book you can recommend that I can have my parents read in preparation for attaching with these infants? If you go to our, I'm going to do this while we're sitting. If you go to our website and you go to the Amazon page, right, where we talk about, I'm actually clicking through my own website right now, and you go and you look at the the book list. I'm looking at it right now, so let's just click on one here. I think they have an attachment. Yes, they do. There's an attachment, and let me post this for all of you. I don't have a moderator, so I'm doing this. Go here, copy that, and go there and look in the category on attachment, and you'll find the ones that we have listed there are attachment, trauma, and healing. The other one is Journey of the Adopted Self, The Primal Wound, 20 Things Adopted Kids Wish Their Adopted Children Knew. That's more for adoption. Beneath the Mask, Understanding Adopted Teens, The Mistress's Daughter, 20 Life-Forming Choices Adoptees Need to Make, Becoming a Step Family. So there's a start there. Primal Wound is kind of a famous, popular old one, but anyway, hope that can be helpful. We'll be looking at a placement for our 21-year-old son who is with you right now. If he has an attachment disorder, failure to launch, what program would you recommend? I can't. Let me go back to this slide just because I can't really recommend specific programs. I would refer you to your education consultant or your therapist at Evoke. I'm sorry. I feel like it's outside of the area of expertise, so I apologize. I wish I could be more helpful there, but it'd be inappropriate and outside of the scope of my ability. All right, folks, let me get to the upcoming events and slides. Please stay on. Go to these meetings. We want you to go to 6. This is what you can do. This is what you can do to develop what you need to do to be able to provide more healthy attachment. All of you, no matter where you or your child find yourself on that continuum. Follow us, please, on social media to learn about posts, quotes, pictures, stories, upcoming events. You can find my book on Amazon. You can also find it on audible.com. I've been told by parents to make sure that they know, all parents know, that you can buy a CD or audio book. You can go to the Parent Alumni Foundation page, which is the same page that I just posted down there. And you can get the same price books off of Amazon. 10% goes to charity for people who can't afford treatment. Coming up. I know there's somebody on here from Seattle who's been asking. We have a few from Seattle that have been asking. My tentative date, and I'll set it this week, September 27th, 4 to 6 p.m., location to be determined. So that's my goal. I'll have that solidified in the next few days. We're going to start it very simply in New York City. It's going to be on the last Sunday of every month, 4 to 6 p.m. They're going to experiment with that and then see if parents respond to that. So those are some upcoming. We'll have more parent groups across the country coming up. The next Entrada workshop will be October 17th and 18th. Like I said, the Heroic Parenting Workshop, these are the last 2 that I for sure will be running. September 10th through 13th will be at Evoke Entrada. Email Stephanie at evoketherapy.com. And then Finding You is for anybody, parent or not. It's very similar to the Heroic Parenting, only all of the themes won't be about parenting. All the themes will be at life, spouses, who you are, life changes, life stages, and so forth. So that will be there. Somebody put a thank you on here. Just want to say thank you so much for all the webinars you provide for us, from which we learn how to do our work as parents while our child is in the program. You're very welcome. It is my passion. You can find out about our New Pursuits program by going to our website. And then the next webinar will be Living with Anxiety, talking about parental anxiety this week. So that'll be Tuesday, September 8th at 15, of course, 6:30 p.m. Mountain Time. So tune in for that, and I will have a moderator for that. So we'll be back to functioning as normal. I hope this is helpful. You can request the slides by emailing us at webinar@drbradreedy.com. If you're a parent currently in the program, you should know that you can go to any webinar on the parent portal and click on the PDF and download the slides so you can have access to all the quotes and notes that are there. So, all right, folks, have a great holiday weekend, and I will talk to you Sunday evening at 6:30 Mountain Time. Take care. Take care.